get that straight. I think, you know, with life, liberty, and the pursuit of happiness being some key things in the Constitution, I'd say life, liberty, the pursuit of happiness, I could easily make the argument that that would include access to health care as part of staying alive. Don't we have health care as a right? Well, we certainly signed on to many UN agreements that say that access to health care is a universal right, except no one forces us, even though we signed this UN thing. That doesn't say that we actually have to do anything about it, so we haven't. To me, I've, you know, finally come to how we got to public education as a right, of a publicly financed public education in this country, was a state-by-state political fight. It didn't just happen. It's not in the Constitution anywhere. It didn't take one big court case. It didn't take one big legislation thing. And like Winston Churchill said, the Americans can always be counted on to do the right thing after they've tried all the other alternatives. And I think that's what we're going to do with healthcare. You know, in this past you know, legislative session in Washington, Olympia Snowe said, well, we ought to have a mechanism, a trigger when we would actually pass some decent healthcare. This one, we're not quite there yet. And I thought, so how many, you know, it's up to like 45 or 50,000 people in the U.S. dying every year just from lack of health insurance. What's your number, Olympia Snowe? How many? You name the number, you know. That's not enough for you? You know, every legislator, even if these people don't vote for you, even if they don't have money to give to you, even if they, you know, voted against you, you are still representing them. And these people are suffering and dying. So in America, we are dying for health care. So I'm kind of preaching to the choir. You don't need to hear all that, but you know the stories, you know the people, you've heard the suffering, but I get to hear it a lot more condensed, so I figured I'd share just a few anecdotes with you. So I'm basically here to get you all riled, to keep you riled up, and to not say it's done, oh, it's fixed, thank God they passed that national health reform, and we can all relax and do something else. So I'm not worried about you types doing that, but I want to really motivate you to keep up the pressure, the state level, the national level, you know, form those ongoing relationships with your legislators. That's what really counts. Of course, send them some money, I'm sure they're very happy for that to happen, but the personal connections and the personal stories, you know, it's like the old Stalin quote, you know, one death is a tragedy, a million deaths is just a statistic. So, you know, it's amazing these legislators, they hear, you know, we have 700,000 people in the state with no health insurance. Yeah, that's a sad thing. What are we going to do about it? But, you know, we go to the hearings in Olympia and they say, well, but my Aunt Sally, she actually had a problem with her health care access, and by golly, now it's an important issue. Like, don't the other 700,000 people count besides your Aunt Sally? You know, do you have to see these people dying on your doorstep? So, anyway, you know about that. So, besides the kind of local, you know, measures, we're trying some local, you know, tape and Band-Aid kind of things to try to have local access to health care be as good as it can be in the current system. And I'd say the national solution is the real solution. But here in Washington State, we don't want to sit around waiting for the feds to get the thing done, because I think in America it's very possible it may happen on a state-by-state basis. I'd say the Massachusetts mess, as I call it, is not the model. That's kind of what they based the national reform on, that you ought to all just have health insurance and you're required to have it, except if you can't afford it or the fine is higher than the health care coverage, well, we'll let you just pay the fine and still not have health insurance. So I don't think that's a good model. I'd say it should be a right. It should be like Medicare. You know, we could say, all right, you know, who exactly in some criteria, but it should be an automatic thing. You're an American, you know, resident. It should be automatic. You know, that's how Medicare was created, after a lot of hard political fights, and within 1 year, pretty much every eligible person was signed up. and you know, because you didn't have to go out and buy it. And so we have a model. It's a completely U.S. model. We don't, you know, we can look all around the world for great models, but we've already got it in the U.S., so we don't have to reinvent it. We just have to improve what we've got. In the meantime, I would make a strong pitch, something you all can do. Initiative 1098 is the Bill Gates Senior ballot initiative. They're trying to get on the ballot this fall for the November 2nd election. And there is our county chairman, Jean, and she will get you all hooked up. I want to make sure every one of you signs it tonight, if you're a Washington registered voter, that you sign it, and I would say even better, take at least one form with you and get at least 20 other people to sign one, because we really need it. It will create an income tax for the first time in Washington State, just on individuals making over $200,000 a year individually, or $400,000 a year per couple. That's the richest 3% in our state. They just deduct it off their federal income tax anyway, so as far as I can tell, they won't actually pay any more tax. They just keep it in Washington State. It cuts the state property tax by 20%, so it helps the middle class. It cuts the B&O tax, the business and occupation tax, for 80% of Washington businesses will not have it anymore. It's been a huge drag on businesses. And we estimate it will bring in a net $1 billion a year, 70% directed straight to a trust fund for public education. I don't know, I'm from Ferndale, and we're laying off teachers left and right after we, you know, cut all the administrative positions. Now we're cutting all the teachers. I don't know if you're like that, but that's how we are. Puts the other 30% after it fills the gap in the tax cut. First you fill the tax cut, then it puts a 70% directly into health care, into public education. The other 30% into the basic health plan, long-term health and disability care, public health, things that have always needed some reliable money. So that's, we're trying to get on the ballot this fall, and we've got till July 2nd to get about 320,000 signatures, and we're working hard, and people like me are out there campaigning, and Jean, and trying to get it on the ballot, so appreciate that. So we'll circulate these around on the break, so please do not leave without signing one, and ideally taking a blank form with you. The one thing I would just say is on the back of the form, if you're the one gathering signatures from Washington voters, each person can only sign it once. This is not Chicago. And the only thing is you need to tell them to print your name in the first column, then sign the second column, then their street address and city and county. And then you need, if you're the signature gatherer, you need to put your name on the back of the form, print it and sign it. And then the address is right on the back and the website. And what we'd really like to get is people out hitting big events with big crowds. Big crowds waiting for something to happen. That's the perfect scenario. So there's all sorts of things, farmers markets, etc. And generally this has a very good signing rate. So my short version of it is tax the rich for health care and schools. Or cut your taxes, tax the rich for health care and schools. So depending on which demographic you're pitching it towards. That's my pitch, so thanks very much.
Thanks very much, Chris. I also want to mention that Chris was very instrumental in getting an initiative passed, making sure that smokers not smoke anymore, and Chris led the charge on that one. So.